Welcome to Trak Consulting, Phlebology Revenue Cycle, Billing, and Collections Management. Trak Consulting was founded in 2001 by Natalie Birch and Jewel Kopfman. Since then, we've grown to over 100 employees offering a variety of practice management services nationwide, from Alaska to New York. Trak has vast experience in providing phlebology billing services as well as other specialty services. Trak has credentialed, experienced coders with a specialty and focus on phlebology-related services, and a proven track record of collection success. We encourage you to compare Trak's pricing structure with our competitors. We are 100% confident with our value increasing your collections. Here are the top 10 reasons why you should choose Trak. Increase collections. Reduce operating costs of infrastructure and personnel. Timely and accurate pre-authorizations. Maximum information security. Timely submission of medical claims and follow-up. Meaningful use assistance and compliance. Quality assurance on turnaround times. Innovative technology and experienced workforce. Reduced workload of managers. Round-the-clock assistance to customers and maintaining good technical care. But don't just take it from us. Let's hear what our clients have to say about working with Trak.
Trak has been very beneficial for Physicians Vein Clinics. We exclusively do vein care here at Physicians Vein Clinic. They've been able to collect a higher percentage, as well as they're always in contact with me if there's an issue. They also do a lot more for me than what my previous provider had done. The great thing about with Trak and the billing process is really I don't have to be involved. Basically, I just do my coding and what's appropriate for that specific patient, and then I send them the information that they need, and then it's done. One of the things with Trak that's been very beneficial is it's removed some of the administrative process from me on the billing side. It allows me to spend much more time with patient care, worrying about patient care, doing follow-ups as needed, versus taking my time out of my day and doing the billing process. And that's been extremely beneficial for my clinic. It's allowed us to grow. We're actually getting ready to start our third clinic with the help of Trak. Well, one of the best benefits to Trak is the consistency. I know that when I get things sent, that things are going to come back. I also know that they're going to give me the information that I need to help grow my practice. That's one of the great things, is I always know that I can count on them.
Now, let's take a look at our successful collection rates. Let's discuss the consulting services we offer. Medicare audits pre-review. If you are providing services to Medicare patients, you should ensure your coding and documentation are bulletproof. We can help ensure you will pass any audits by Medicare. Payer audit review. In addition to Medicare, many of the various Blues and other payers are significantly more aggressive in reviewing practices for fraud. We can help ensure you pass these reviews as well. Accounts receivables review. We can provide a comprehensive review of your AR to determine how well your revenue cycle processes are working. Practice performance review. A detailed examination of your practice patterns, bill charges, and services provided as compared to a baseline developed by working with other phlebology practices. Contracting support. We have significant contract management experience and can help guide you in obtaining contracts with several payers in your area, including Medicare. Appeals and denials management. Sometimes your internal biller just needs some assistance on a claim or set of claims. We can assist them in gaining both the knowledge and the tactics we use in fighting denials. Marketing support. While we are not a marketing company, we can offer some ideas and tips that have worked for many of our other vein practices. Here is what sets our billing and collection services apart from the rest. Timely and consistent billing. We strive to submit your claims by the next business day after coding review. Coding review. Our certified and experienced coders are trained in phlebology coding. Ensuring the correct codes with the correct modifiers and proper diagnosis is critical to smooth reimbursement. Clearinghouse reports. These reports are reviewed every day and any submission errors are identified, corrected, and resubmitted. Collections. Should a claim not be paid within 60 days, we begin our collection process to determine why you have not been paid. Patient collections. Once the insurance company has paid, we send statements and initiate requests for payment letters on delinquent patient accounts. Chart notes. Payers frequently request documentation for phlebology services. Our methods ensure documentation submission and speed up the payment process. We have a proven track record for practice startups. Profit and loss forecasting. We have data from our previous startup practices which incorporates cost, income, patient volumes, and similar necessary data for planning purposes. Software selection. We can assist you in finding software solutions that meet your practice needs from EMR, practice management, to accounting software. Contracting and credentialing. Our team can provide contracting and credentialing support to new practices. We also work with practices that are transitioning from a cosmetic or cash only to one that is accepting insurance for services. Practice management. DT Trak Consulting can provide you with overall management support. Let's listen to how we have helped our clients in these areas.
With DT Trak, I've actually become very comfortable with them. We actually have a consistent group of people who work on our processes, our billing, as well as help with our credentialing so that I know who my contact people are. And that's been extremely important. My staff has actually been very happy with the way that things have gone. They take away, again, those pieces that I don't want to deal with, that I want to deal with as the owner of the business. I need to look at growth, not just simply billing processes and credentialing. I've got a new nurse practitioner starting as well as a new physician starting. They've done the credentialing for me as well, which is, as everybody knows, is if you're a physician, that credentialing is really cumbersome and time consuming. It's not something that I want to do. At DT Trak, one of the things that's been very beneficial for us is they've actually taken on somewhat of a larger role than what my previous billing company had, but I can also rely on them. They're actually a little less expensive, but they also do follow-up. What I found with my previous company is they would write things off that I didn't even know about. Nobody had even asked me about writing it off. There was no questions. It was just simply all of a sudden it was gone off the books. And what the company had decided is that it wasn't worth their time to do it. To where with DT Trak, they actually consistently follow up with patients. They follow up with me and let me know what's going on. One of the things that DT Trak has done for me is that they've taken over a little bit more than what my previous billing company had done. They actually do some of my pre-authorizations. As we all know in phlebology, it's actually very important to get your conservative therapy, all of those things in place, as well as your pre-authorizations. DT Trak has been willing to help out on that pre-authorization, which is of course how we get paid.
Here are the top 5 common errors we can help you avoid. Modifier 25. Bilateral services and modifier 50, RT, and LT. Global periods. Diagnosis pointing and medical necessity. Billing adjunctive services. DT Trak Consulting can help you avoid these types of errors with consistent documentation, coding, and billing. Here are some of our value-added benefits. Thank you for taking the time to listen to DT Trak Consulting information. We look forward to working with you in the future. DT Trak Consulting, phlebology revenue cycle, billing, and collections management.